When a doctor says the word surgery, many people feel fear and agree immediately without asking questions. Health is a serious matter, and most of us think there is no time to hesitate. But the truth is simple. Not every surgery is urgent. Not every surgery is the only solution. This video is not medical advice. The purpose is not to scare you, but to inform you. Every person's health condition is different. However, in many cases, rushing into surgery can later lead to regret. Today we will talk about situations where surgery should not be the first choice. These are conditions where many people agree too quickly, without exploring other options. And most importantly, before making any decision, it is essential to consult more than one doctor. Knee replacement surgery. Knee pain becomes very common as people get older. Many patients are quickly advised to replace the knee joint. However, knee pain does not always mean that the joint must be replaced. In many cases, the real problem is weak muscles, excess body weight, poor posture, or lack of movement. With proper physical therapy, strengthening exercises, weight control, and lifestyle changes, knee pain can improve significantly. Knee replacement is a major surgical procedure. Recovery takes time and effort. The results are not always perfect for everyone. If knee pain has not completely destroyed your quality of life, non-surgical treatments should be tried first. Herniated disc surgery. Back pain and disc herniation are very common diagnoses. But the majority of people with a herniated disc recover without surgery. In many cases, pain improves gradually with time. Targeted exercises, correct sitting and walking habits, weight management, and regular movement can reduce symptoms significantly. Surgery is usually necessary only when there is severe nerve compression, loss of strength, or loss of bladder control. If pain is the only symptom, surgery is often not urgent. That is why seeking opinions from other specialists is extremely important before agreeing to disc surgery. Early stage cataract surgery. Cataracts develop slowly over time. In the early stages, vision may become slightly blurry, but daily activities are often still manageable. In these cases, immediate surgery may not be necessary. Improving lighting conditions, reducing eye strain, and having regular eye checkups may be enough for a period of time. Cataract surgery can be very effective, but it is still a surgical procedure. If vision does not significantly interfere with daily life, it is reasonable to wait and monitor the condition. The best decision is made after consulting more than one eye specialist. Unnecessary heart stent placement. Heart-related diagnoses naturally cause fear. Because of this fear, many people agree to procedures without fully understanding their condition. Not every narrowed artery requires a stent. In many cases, medication, lifestyle changes, proper diet, and regular physical activity can control the condition effectively. Stents can be life-saving in certain situations. However, placing a stent unnecessarily can lead to long-term medication use and potential complications. That is why getting a second opinion from another cardiologist is extremely important before making this decision. Hysterectomy removal of the uterus. Many women are advised to remove the uterus for various reasons. This is a very serious decision with long-term effects on the body. In some cases, hormonal treatment, monitoring, or less invasive procedures may be sufficient. If there is no cancer or immediate danger, surgery should not be rushed. Removing the uterus can affect hormonal balance and overall health. This decision should never be based on a single opinion. Consulting multiple specialists helps ensure that all alternatives have been considered. Final warning and conclusion. Once again, this video does not replace professional medical advice. The goal is not to discourage necessary surgery, but to prevent rushed decisions. Your health is not an experiment. Do not be afraid to ask questions. Do not hesitate to seek another opinion. Before agreeing to any surgery, always consult with more than one doctor and then make an informed decision. A second opinion can sometimes protect your health, your quality of life, and even your future. If this video was helpful, consider sharing it with others. This information may help someone avoid an unnecessary decision. Why second opinions matter so much? Many people believe that asking another doctor means distrust. In reality, it means responsibility. Medicine is complex. Doctors are human. Different specialists may see the same condition from different angles. A second opinion does not mean the first doctor was wrong. It simply means you are giving yourself more information. Sometimes another doctor may suggest a less invasive treatment. Sometimes they may confirm that surgery is truly necessary. Both outcomes are valuable. In many countries, patients are encouraged to seek multiple opinions, especially before major surgery. This is not a sign of weakness. It is a sign of wisdom. The psychological pressure around surgery. Fear plays a huge role in medical decisions. Words like surgery, tumor, blockage, or degeneration immediately trigger anxiety. When fear takes control, logic often disappears. Some patients feel pressured by urgency. They hear phrases like "do it now" or "it may get worse." While urgency is real in some cases, it is not always the case. Understanding your condition calmly can change everything. When fear is reduced, better questions are asked. Better questions lead to better decisions. When surgery is truly necessary, it is important to say this clearly. Surgery can save lives. Surgery can restore movement. Surgery can relieve suffering. This video is not against surgery. There are situations where delaying surgery can be dangerous. Severe nerve damage, advanced cancer, life-threatening heart conditions, or internal bleeding require immediate action. The key difference is clarity. When surgery is necessary, doctors can usually explain clearly why it cannot wait. If explanations are vague or rushed, that is when more questions should be asked. Questions you should always ask before surgery. Before agreeing to any operation, there are important questions every patient should ask. What happens if I do not do this surgery now? Are there non-surgical treatments I can try first? What are the possible risks and long-term effects? How will this surgery affect my daily life in the future? Is it reasonable to get another opinion? A good doctor will welcome these questions. A rushed decision often begins with unanswered questions. The role of lifestyle in healing. Many conditions that lead to surgery are connected to daily habits. Lack of movement, poor diet, chronic stress, and insufficient rest slowly damage the body. Small changes can create powerful results. Regular walking improves circulation. Strength exercises protect joints. Healthy food supports the heart. Proper sleep helps healing. Sometimes surgery is suggested when the real issue is lifestyle. Addressing the root cause can delay or even prevent the need for surgery. A final message to viewers. Your body carries you through your entire life. Every decision you make about it matters. Surgery should be the last option, not the first choice. Always seek more than one medical opinion before making a decision.